All right, today on our opportunity for health accumulation, we're talking about hemochromatosis and the fact that so many are so concerned about taking iron because if I get too much of it, it will cause organ damage. Which, yes, if you get too much iron, it will cause organ damage, affecting your liver, your heart, your brain. But this has very little to do with most of people who are trying to overcome iron deficiency. And given how the social health influencers speak of iron, you would definitely think this is a huge worry that, oh my goodness, we're all going to end up, if we take iron, with hereditary hemochromatosis and have organ damage and all that kind of thing. Thankfully, I'm here to give you a well-rounded view, hopefully, of the opportunity that is optimizing your iron levels and not having to concern yourself with hemochromatosis. So hit that subscribe button, click the little bell to be notified when there's a new video out. Because as always, I'll hang out for about 30 minutes or so after the videos are released to respond to any concerns or comments you guys have related to this topic. So the first thing to consider is what is hereditary hemochromatosis versus just straight up what we call hemochromatosis. And because they are definitely different things, they're not the same thing. And I think many people think that hemochromatosis is hereditary hemochromatosis, like it is the genetic thing here. So the first thing to understand is that hereditary, hereditary, right? Genetic family line. Hereditary hemochromatosis is a genetic mutation in the HFE gene, and most commonly it's with the C282Y and H63D mutations. So these mutations, they promote an excessive iron uptake by the body and storage of iron. In fact, almost kind of like wacky storage of iron. And this is because there is a genetic defect because of these mutations in the production of hepcidin, which we talked about a lot of times. Hepcidin is that thing that basically decides how much iron you can have and how much iron you can't have, absorption-wise. So normally, hepcidin would be in charge of shutting down iron absorption when levels are sufficient. But when there is a mutation, that doesn't happen. So for those with the most common type of hereditary hemochromatosis, all things the same, they have about a 10% chance of being symptomatic and having significant iron overload symptoms leading to what everybody's worried about, generally, the tissue and the organ damage. So that's pretty, 10% of those with hereditary hemochromatosis actually would potentially end up with, symptoms and organ damage. And you can see this in one of my patients' lab reports right here, whose ferritin, you see, was 1,294. So they came in, had high blood pressure, joint pain, fatigue, and it was not being controlled by their high-dose antihypertensive medications. And unfortunately, nobody ever checked their iron levels, their ferritin levels. They're just like, nope, CBC is good, chem panel is good, you got high blood pressure, you got joint pain, fatigue, let's give you some blood pressure medications and call it good, even though they're not working. So this showed up, 1,294. That's suggestive, like there's probably something going on with this person beyond just, because especially if they're not obese and don't have all these other signs of inflammation going on. So we checked them out, and lo and behold, just like those mutations I mentioned, they came back with two mutations showing hereditary hemochromatosis on the C282Y and the H63D mutations. And so they were diagnosed with hereditary hemochromatosis. And we ended up basically doing a therapeutic phlebotomy. And after about 11 months or so, their levels, the ferritin level came down to about 150, and they were able to stop their blood pressure medications completely and maintain normal blood pressure. Wild, huh? Simply, from all that we can tell, is just getting all this excess irritation out of their body. So labs that I would always do, I would do them for every human being that came in office, but especially if you have any suggestion that there's hereditary hemochromatosis, I would look at a iron saturation, I would look at a ferritin, and I would look at a total iron binding capacity for sure. And the if iron saturation is over 60% and there's a higher normal ferritin, I'm definitely going to think I should check for the gene mutation. You know, I've seen hereditary hemochromatosis most commonly manifest symptomatically, like I mentioned, kind of like this one patient, which is just like fatigue, lethargy, especially in guys, just general joint pain and stiffness, but no like major arthritis that is noted, and then hypertension on multiple occasions now. And this is especially, you know, these people usually have a ferritin, right, between 1200 and 2400. And yes, lifestyle adjustments are often needed along with therapeutic phlebotomy. All of the symptoms will often just dissipate if you get those ferritin levels normalized. And I think every single patient, no matter what they're coming into the office for, like I mentioned earlier, should get at a minimum, you know, a full iron panel, iron saturation, ferritin, all that, every other year. I would just do it, you know, because iron levels can tell us so much about inflammation, about potential of iron load related to genetics, as well as, you know, malnourishment and, you know, iron deficiency or, you know, blood loss via our digestive tract. You know, way before we get all the way to anemia, you know, that kind of thing. So many times people, you know, jump straight to, I have hereditary hemochromatosis, or they may not even know that word hereditary or, you know, belongs there, but that's what they're suggesting, like it's my genes. That's when my iron levels are high, that's when my ferritin's high. When, you know, they get the iron panel back and they see that their ferritin levels are 700-800, when in reality, it is very common here in the United States of America that the actual person has metabolic syndrome with excess fat hanging around in their trunk area and their upper body, you know, their chest area. And I've seen this before in 3 generations of families, like where, you know, grandpa, son, grandson, where literally just fat in that family tends to accumulate around the abdomen and the waist up, maybe, you know, very thin legs, thin arms, but just all in the truncal obesity. And their ferritin levels, they're up, they're really high. You know, it's 700, 800, 900, 650 kind of thing. And when they adjust to lifestyle, line up, they get their body composition, you know, in a better space, lose a lot of that truncal obesity. Amazing enough, their ferritin comes down to optimal range. And that is not going to happen in hereditary hemochromatosis. That is going to happen in hemochromatosis from you know, iron overload related to obesity and inflammation in the body. So as inflammation goes down, so does the ferritin excess in the blood. So you can basically do therapeutic phlebotomy to those people all day long and nothing changes other than you may make them anemic in the process. So the term hemochromatosis also encompasses, you know, this excess iron accumulation from you know, multiple blood transfusions or like sickle cell disease or certain thalassemias. I would say that is an entirely different subject that, you know, just like gotta get your doctor on board there. And you know, that's a kind of a specialty there. So we're gonna stick to the most common things here. Understand that just because you have the gene for hereditary hemochromatosis, though, it doesn't mean you might not eat iron. You still might need iron. You could still be iron deficient. You could still even be iron deficient anemic. And that, you know, you should be running away from iron deficiency states so that you don't end up with, you know, organ damage. Like, I can't take iron. Like, it's better for me to be iron deficient because I have hereditary hemochromatosis, or I have a gene for that. No, optimizing is just as valuable. And plenty of people, especially menstruating women, vegetarians, vegans, endurance athletes, who have hereditary hemochromatosis gene, will still end up iron deficient and literally underperforming in life because of it. You know, so don't wait till you're in menopause to get yourself normalized. Low iron, you know, it's just as harmful to the body as high iron, if not more harmful in many cases than excess iron. You know, without sufficient iron, energy cannot be created efficiently in every cell in our entire body. What's this do? This ages. This strains the cells, you know, making regeneration slower, you know, the potential for dysfunction so much higher. You know it. That's that fatigue, that's the depression, the anxiety, the racing heart, the you know, shortness of breath, going upstairs, just the hair falling, all that. That's all signs of degeneration in the body. So I think it is vital we don't use single words to gloss over, you know, everyone. That's a problem we have in the Western world. Is we jump, you know, we want to put everybody in these boxes so that we can do this research, and so, you know, let's make everybody essentially the same when every person's unique. one person can take 15 milligrams of elemental iron, symptom relief within days. The next person needs 30 milligrams of elemental iron, and it takes 3 months for symptom relief to show up. Both need iron, but they're individuals. They're unique in themselves. So always ask to be treated as an individual, not a protocol. If you have hereditary hemochromatosis, you did the genetic studies showing, yep, you got it. But if your iron levels are low, you still need iron. If you have high ferritin levels and you're getting therapeutic phlebotomy on a regular basis to get those down, and yet they're not really hardly moving, well, you might want to consider that maybe it's part of the inflammatory process of your body that's at work, and we need to get the inflammation under control. It's not just the ferritin. So be so careful when you just say, hey, I'm just going to take this one value and place all my nuggets there, all my gold there. You got to take the whole picture, just like you want your body, your being, to look at your body as a whole human being. It's not just the heart, it's not just the kidneys, just the liver, just the brain. No, there is no part of our being that isn't connected, interacting at every second, at every day, all the time, everywhere. All right, Dr. Matt, hope this is helpful. Man, check out below for more information about optimizing your iron, and there's even a guide I have for you guys. It's free. You can check it out, and I hope it's super helpful. And man, let's get iron deficiency X'd out. Let's make it so there's no more people walking around deficient in something that is so easy to remedy. All right, talk to you guys later.